Autism spectrum disorder is a developmental disability that can cause significant social, communication, and behavioral challenges. There is often nothing about how people with ASD look that sets them apart from other people, but people with ASD may communicate, interact, behave, and learn in ways that are different from most other people. The learning, thinking, and problem-solving abilities of people with ASD can range from gifted to severely challenged. Some people with ASD need a lot of help in their daily lives, others need less. People with ASD often have problems with social, emotional, and communication skills. They might repeat certain behaviors and might not want to change in their daily lives. Many people with ASD also have different ways of learning, paying attention, or reacting to things. Signs of ASD begin during early childhood and typically last throughout a person's life. Diagnosing ASD can be difficult since there is no medical test, like a blood test, to diagnose the disorders. Doctors look at the child's behavior and development to make a diagnosis. ASD can sometimes be detected at 18 months or younger. By age 2, a diagnosis by an experienced professional can be considered very reliable. However, many children do not receive a final diagnosis until much older. This delay means that children with ASD might not get the early help they need. If you think your child might have ASD, or you think there could be a problem with the way your child plays, learns, speaks, or acts, contact your child's doctor and share your concerns. If you or the doctor are still concerned, ask the doctor for a referral to a specialist who can do more in-depth evaluations of your child. Specialists who can do a more in-depth evaluation and make a diagnosis include developmental pediatricians, child neurologists. By visiting www.autismspeaks.org/resource-guide/state/PA, there will be many resources that can help with financial and legal, biomedical interventions, community and support networks, early intervention for ages birth to 3, health services, interventions, preschool ages 3 to 5, related services, and school age ages 5 to 22. Structured teaching is a strategy that can help many teachers and students. It is based upon an understanding of the unique features and characteristics associated with the nature of autism. Structured teaching describes the conditions under which a person should be taught rather than where or what. It is a system for organizing their environments, developing appropriate activities, and helping people with autism understand what is expected of them. It utilizes visual cues which help children with autism focus on the relevant information, which can at times be difficult for the person with autism to distinguish from the non-relevant information. BoardMaker is a great form of assistive technology that can be used with your students. It is an electronic symbol library that is used extensively by teams supporting any students, including those with ASD, who require visual support for oral comprehension. The program has an easy-to-use search engine which allows the user to search for symbols as whole word, beginning of word, or anywhere in Word. The symbol can be set to display as black and white or color and can include the name of the symbol in a number of different languages. The program comes with over 3,500 picture symbols, and additional can be purchased to increase the number. The ability to use both symbol and text in various sizes means the program is appropriate for students requiring varying amounts of visual support. There are 10 things every child with autism wishes you knew. 1. I am a child. 2. My senses are out of sync. 3. Distinguish between won't, I choose not to, and can't, I am not able to. 4. I am a concrete thinker. I interpret language literally. 5. Listen to all the ways I'm trying to communicate. 6. Picture this, I'm visually oriented. 7. Focus and build on what I can do rather than what I can't do. 8. Help me with social interactions. 9. Identify what triggers my meltdowns. 10. Love me unconditionally.